I want to welcome everyone. So my name is Paula Han. I'm the Program Director for Interior Health Renal Services, and I'm coming to you today from Kelowna, which is the traditional non-ceded territory of the Syilx Nation. I would like to welcome you to this end-of-day plenary, which is going to be, you're in for a treat for sure, journeying together, creating a map that matters most to patients. What a wonderful way to circle back around to everything that's been said today. We are here, whether it's patients, caregivers, or healthcare, we're here to be better together. So before I introduce our amazing panel, a couple of housekeeping tips. Don't forget to keep your Q&As coming. You guys should be experts now by the day as the day moved on. And also, we will have some poll questions, so please participate. Let's use technology. So it's my privilege to introduce to you our panel. So Laura Bennet is a patient partner, and she likes to balance her hemodialysis by doing things that brings her joy, which includes reading, acting, directing, singing, community theater, and if that's not enough, she writes. And so she does all of this in her spare time. So her skills of facilitating and planning in her professional life sure helps her organize her life. Kathy Shotton is a patient partner, and Kathy gave the gift of life. She gave her daughter a kidney. She donated some time ago, and that gift is immeasurable. And she volunteers and is a dancer and does yoga. Deborah Litvak is a social worker of almost 30 years. She's currently in the hemodialysis unit at BGH, and she's a self-professed, lifelong non-pet owner until her daughter of 19, Jilly, now has a 2-month-old Aussie Doodle puppy named Bean. So she's smitten by Jilly's Bean. Susan Rawlings is a patient educator from the Northern Health Home Hemodialysis Program, and she's the mother of 6, expecting her 15th and 16th grandchildren in March and April. She loves to read and loves to travel. Finally, Helen Chu, our quality lead for BC Renal. Her passion is to work with diverse voices and with a goal of achieving goals and positive impacts together. So if she's not hiking and reading, she's creating with Legos. Seriously, just ask her. So, just a second. I believe I'm hearing something. I believe there's some new breaking news coming in. So Helen, what's on the go?
Wouldn't it be nice if every patient had a roadmap to focus on what matters most to them in their kidney journey? In healthcare, it is called goal setting. It is a pivotal element in patient self-management, and it refers to the process of acquiring information for and setting of specific collaborative goals between health professional and the patient in managing chronic conditions. The focus is on what matters to the patient. The process involves a series of iterative conversations to understand what matters to the patient, to set an overarching medical and or non-medical goal, to break down that goal into shorter-term goals over time with realistic and concrete action plans, and to follow up and provide support if needed. Improving patient goal setting has been a priority of our kidney community in BC. Frontline kidney health professionals, managers, patients, family caregivers took part in the series of focus groups across the province last year. Participants identified the gaps for having these important conversations and generated ideas to address them. In February this year, BC Renal hosted a provincial action planning workshop. It again included kidney health professionals, patients, and family members, as well as representatives from the Kidney Foundation BC and Yukon branch. These 42 participants built on the ideas from the focus group and developed a concrete way forward for better patient goal setting in kidney care. All of the ideas led to this one-of-a-kind resource Better Together, a strategy to advance collaborative patient goal setting in kidney care. And you may be wondering how this is different from the many other tools out there in healthcare. Well, this is really actionable and it is not prescriptive. The ideas described can be readily adapted according to the needs of the local kidney care setting. And what's in this document, you may ask? Well, it outlines a framework that embraces the spirit and processes of motivation interviewing, which some kidney health professionals are already familiar with. Importantly, though, it brings together the relevant tools and resources already available to our kidney community in BC, such as What Matters to You, the self-management programs, brief action planning, serious illness conversation guide, My Symptom Checklist, also known as ESAS, and the BC Renal Transition Guide. It also highlights a number of practical ideas drawn from the focus groups and workshops. Those practical and actionable ideas are in four main categories. Partnership is about drawing on the collective wisdom of patients, family caregivers, and health professionals to work as a team. Awareness is about raising awareness of goal setting and understanding what it really is. Adaptability is about having a flexible process and safe space to have those important conversations. Support is about enhancing the support for patients and their family along the whole journey. The list of ideas is also provided in a fillable worksheet, so any group of healthcare providers and their patients can use it to make some changes with impact to improve patient goal setting. Interested in learning more? Visit the BC Renal website and check out the strategy, along with links to relevant resources. Together, we can optimize patient experiences and outcomes with better patient goal setting. Helen Chu, BC Renal News, Vancouver. Back to you, Paula.
Thank you for that, Helen, and you heard it here at BC Kidney Days. So Helen, thank you for that. And now before we get going on our panel discussion, which you're in for a treat, let's get the energy going with our first poll question. And like I say, it's practice. You've had lots of time to practice today. So let's have a look. We're going to give this a few seconds to get in here. So let's get our polls up regarding the categories that you would like to improve in your kidney care clinics. And as we're moving through here, so a part of these have been adapted. These categories are from the framework that Helen talked about. So what are we seeing here? Everybody wants them all. Wow, that's amazing. And yes, we do need it all. We'll just give it, okay, so we'll just give it a few more seconds here. And thank you for participating in that. Okay, so now we're going to get to our wonderful panel. And so we're going to talk a little bit about, as the day has progressed, we've moved into talking about conversations, and that's what we're going to do today. And so I wanted to start with Laura. And Laura, just from your experience, I'm just wondering what you have found in your journey that has been a bit of a challenge in terms of goal setting.
Oh, thank you, Paula. I'm very glad to be here and be able to speak to this. There are so many things when your kidneys fail that you're getting information overload on, and setting goals during that time seems so overwhelming. What I find is the best way for reaching the desired goal is if we start in smaller steps, so that we have that fairly instant satisfaction of success. An example of this was finding out all of the different things that I had to change or look at in my renal diet. Things that normally I would eat because they're healthy, but then no, you actually can't. You shouldn't have cooked spinach, shouldn't have this, shouldn't have that. And it was really overwhelming to think about how I could adapt my meals and the ingredients that I had that I couldn't afford to just throw out and replace. But then the renal dietitian at our unit was wonderful. She came in and she helped me look at things like, budgeting, what I could do to make what I had a little bit better until, like, to use it and then replace it with something. And so we started with small things like this week we'll cut out, this and that, or, and then I'd feel like, oh, okay, I've done it, rather than, all right, you need to do this, that, this, 7 other things, and in 5 minutes. And it'd be like, oh no, what's going on? So that really was the key for me. And Kelly was a lot of help in helping me adapt and helping me feel like I was contributing to the success of my, to better my health.
Thank you, Laura. So when basically over just an overload of information and having to grapple with it and fit it into where it needs to go.
Yeah, and it really is a lot. And when you're so sick, you just cannot keep all of that information. So even at the time, get the information that you need to get you through the day or the next couple of days. And then your healthcare provider, your team can give you a little bit more, just so that you're actually absorbing it and not only glomming onto one piece of it, for sure.
Thank you, Laura. So to Kathy, you're a caregiver and a mom, and in terms of your journey, what has been one of the greatest challenges or barriers that you have found in terms of that goal setting, or what really matters to you as a caregiver?
As a caregiver, well, thank you, Jen, and thank you for having me. I'm happy to be here too. As a caregiver, it's so important to be flexible above all else. Goal setting is such a personal thing. What works for one person doesn't work for another. And if there's going to be any buy-in, a personal conversation is so important. What works best for them? Now, for my daughter, who's only 35, that was usually things like online graphs, exercise tools and apps. She's got a Fitbit, recipe apps, online checklists. And I would just like to say, wouldn't it be great if those food prep boxes came for renal diets? She'd be all over that. For other patients who might be older, maybe that looks like a pedometer or a journal, maybe recipe books or written checklists, things like that. But as Laura said, it's all good on a good day, but on her very worst days, it was also overwhelming. She'd be so very sick, and trying to think about exercise, diet, medication, dialysis, all at once, it was overwhelming. And I remember on more than one occasion, she would say, Mom, I just want to feel like I've done something right today. And this is when everyone needs to be very gentle with themselves. Scale back your expectations, whether it's an online checklist or whether you get out a pad and pencil, or maybe it's a Zoom call nowadays. You need to think about and aim for just 2 or 3 things that day. Maybe you ate 2 healthy meals. Maybe you did some exercise, or maybe you just got outside. Maybe you did something for your mental wellness, and maybe that was just listening to music. Maybe you just had a good dialysis run, and maybe you just watched your fluid intake. It's important every day to feel some accomplishment, and as a caretaker, it's so important to support that.
Thank you, Kathy. And so there, that whole, again, I heard overwhelmed again, that sense of overload, and the way that we take information in, whether and depending on how old you are and how, at a developmental stage, we all take in information differently, and that the success for one is not the success for all. Very, very poignant. Thank you for that. So want to move to our healthcare professionals now, and Deb, just hearing what you've just heard there in your world as a social worker, what's been your greatest challenge?
I just want to thank Laura and Kathy. I always learn so much at each conversation. So the biggest challenge, I would say, right off the bat, is that our patients don't feel great when they're first starting dialysis. So it's really hard to have these important conversations and get to know you. some of the environmental challenges are the beds are quite close. So out of respect for your privacy, it makes these important and meaningful conversations quite challenging. For some of our colleagues, we all have different comfort levels in asking the important questions to try and get to know you and what makes you tick. And to get to know these small goals. So one of the meaningful things that have come out of COVID is thinking outside the box and finding ways to have relationships with our patients, not while you or they are dialyzing. So we're trying to help you find your successes off-site. We also find that the days that our patients aren't at dialysis, they feel better typically. So we've used this time for goal setting quite differently. So there are challenges, and we're trying to work through them to make hopefully a better experience, but ultimately to get to know each patient and find out things like, pedometer would work better. Oh, I'm so overwhelmed. And it's really our job to get that information from you. So thank you so much for giving us that very important information.
Mm-hmm, mm-hmm. And to lean onto that, what you just said there about, the same kind of theme about patients are not feeling well at the beginning. We need to build that relationship and have those conversations. So why is it challenging? Why are we having this conversation today?
It's so important to talk to you more than just about your kidneys. It's so important to find out what's important to you. Why do you keep doing this? It's a very aggressive procedure, right? Why are you doing this? What's your quality of life like when you're not here? What can we do to understand what's important to you so that we can make this experience the very best it could be, given the reality of the kidney disease and the intervention that you're going through? To make, hopefully, the bottom line is, and Paula and I have spoken about this offline as well, is in order for you, hopefully, for us to work together, the partnership is the most crucial. And hopefully the relationship developed from the partnership can make this experience the best that it can be.
Thank you. So Sue, being in dealing with training patients and really being intimate for several weeks at a time and then following up, what has been one of your greatest barriers or challenges in terms of getting to that, what matters to people and having that goal setting?
Thanks, Paula, and I'm so excited to be here with these ladies that have so much experience and knowledge. It's been enlightening. I think when I first meet a new patient that's interested or thinks they might be interested in home hemo or is absolutely terrified at the prospect, it's just asking them where they're at, because they're afraid, they're overwhelmed, they're terrified. They've been taken care of by other people, and to make that big step to take that responsibility on to care for themselves is a big obstacle. So I usually try to listen to what they're going through, what they're feeling, how dialysis has impacted their life. And then we try and focus on that dialysis is not their life. Dialysis is a segment of their life, and trying to help them figure out how they can put dialysis in a place in their life that it's not imposing on the rest of their activity. And in doing that, giving them, empowering them to make choices. I can provide a lot of choices for types of care for themselves that will allow them to see how they can fit this treatment into their life without overwhelming their life. It is a challenge, and you constantly have to remind yourself as a caregiver or an educator that it's not our goal that we're looking at, it's their goal, and that goals change. It's a very fluid thing, and as we progress through this period in their life, that we'll see those goals change and evolve, and we have to revisit them on a continual basis to make sure that we're not going off track, because I'm not the one that's setting the trap. I just have to make sure I'm following with them to make them successful.
Thank you, Sue. And I saw Laura, so great segue, Laura. I saw Laura nod when you said that. It's not about us. We like to think as healthcare professionals that, you know, we, and out of care and consideration, but to kind of step out of the way to get to what the focus really is about. So Laura, to that end, you were just nodding about that. It's not about we're all in this together. That's the theme of today's workshop. But what is it then about that would be an opportunity? Just knowing that it's about me. So what is it that you would like to share today to put to everybody listening and watching, that would make it would move us a step closer to success in goal setting?
I think what would really resonate with me would be to have my medical team take a couple of moments to listen to what I have to say. I will admit they're very good at this in the unit that I'm in, but also just really to connect and not be looking at me as, okay, this is, 50-year-old female, blah, 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 but to be like, well, we know that she enjoys theater and wants to get back to that, and like helping me find the ways and the buy-in to be able to follow the new regime, right? But it's really just all about personal connection, I think, is just feeling like a person and not just a case.
Mm-hmm, mm-hmm. Yes, and so what I'm heard there is you need to have dialysis.
Yes,
but you also are passionate about writing and reading and theater. So yeah, thank you, Kathy, and to you. So if you had a message for our listeners today, and I don't know if you've been in part of the other sessions today. What would be your message as we take an opportunity next week, in whether it's our patient partners or whether it's our clinical teams? What can we take to our clinics on Monday morning and begin looking at in terms of opportunities?
Well, I did get some feedback from my daughter actually too on this, and I was with her most days at her dialysis runs. We would play crib, and she usually won. But that was helpful, she said. She said being a part of the team. She had heard some of the technicians and the nurses and the doctors who would come by and visit. She usually did. She has to say a lot of good about all of the renal teams, and that she felt like a part of the team because she would have conversations with them. It wasn't just conversations about her, it actually included her. She felt really good when it included her. She talked about journaling was sometimes nice to be encouraged to do, good days, bad days, and to have, she talked about having somebody in your corner. And sometimes that's family, but sometimes, well, a lot of times that is her team of medical professionals, and that she could talk to. For our family situation, we had sort of within the whole family, lots of visitors. Visitors were good. And mostly she said, yeah, being a part of the team, whether that was her family or the caretaker team.
Great, thank you, Kathy. And so yes, someone in your corner, and you bring up a very good point about just this pandemic that we're living through, and for some people that's social connection, and so we're having to do things a little bit differently with that. So certainly something to food for thought for sure as we look at how we manage our clinics. So Deb, back to you. if you, again, listening to the opportunities so far, what is your big takeaway today, and how would you, when you have your next team meeting or you have your next clinic visit, what is it you're taking away, and would you like to share with all of us about what an opportunity might be?
Well, I would like to bring Kathy and Laura to the next meeting because they're both so much more articulate about what the patient needs. But just to follow up on what you said is that there's a partnership that needs to be developed. I hear it so loud and clear. And for the professionals, when you stop by the bed where the patient is, the actual human, just say, how are you? What's your understanding of what's going on today? Or in general, what's your understanding? What are your hopes? What do you need? Just something to, I hear Laura say, I just want to be heard. So if we can do something, all of us in our day-to-day, and now we're the visitors, we're the family, because people aren't welcome due to COVID for their safety and ours at bedside, all the more reason now to do that listening and get to know you. So that's really my takeaway, that the relationship is essential for and the partnership. So thank you.
Yeah, thank you. And so Sue, to you, I don't know if you're training right now or when you're having your next home hemo clinic, but I wonder for our clinicians on the call, or for maybe your patients patient partners that might be on the call. What is one thing that you see as an opportunity that you can, either in your team or even broader within the health authority?
I think it reiterates that part about engaging the patient in making decisions, empowering them. There are a lot of things that you can't handle with the patient, but there are things that you can. We know that an individual needs an amount of dialysis to feel well, but their schedule can be a little bit malleable, and letting them pick whether they want to run 7 days a week for shorter periods, they want to do nocturnal, or they want to do every other day. Let them pick the machine that they want to use if it's appropriate for where they are. It's just giving them that control back. Renal failure has stolen so much from them, and they've had to relinquish a lot. And to be able to give that back to them, let them make decisions in regards to their health care, I find that it really does lift a big weight off their shoulders, and they start to see the light at the end of the tunnel again. And just to listen, just to always be listening.
Light and listening, if we can, those words just really resonated there. So thank you all, and we're going to be moving into some time for Q&A, so please get your questions in. But I wanted to kind of just, as we wrap this part, this formal discussion up, to just say it's clear that there's some definite themes that are coming out here, and the ability to be in relationship and be in conversation and to get to know people. And so with that, we are going to move into that ability now to have a few more questions, hopefully from people on the line, and if not, I have some. But we're going to put up the next poll question now to our group, and that poll question should be coming here soon. Here we go. So let's look at that. Well, what do we got here? So how more motivated are you now in participating in patient goal setting conversations? Wow, loving this. This is what we want. We've got a little bit probably, but definitely we've got, this is what happens in conversation. And I go back to the resilience conversation this morning with Dr. Jawani, that it takes conversation to understand what should matter most to us. That hit me up the side of the head, actually. And yeah, so we're giving voice to perspectives. So thank you all for participating in this poll. And now we want to kind of move into some questions. I don't know if we have anything. I'm just going to check my handy dandy technology here. I don't know if we have any questions yet. I don't see any. No questions yet. However, why don't we bring Helen back in? Oh, there she is. And I'm going to, Helen, you've been kind of listening as we've been moving along here. And I'm just wondering, what advice would you give to clinics wanting to increase awareness to goal setting? You've done a lot of work on this, on a lot of the toolkit. So I'm just wondering, if people had some questions today, where would you lean them on what advice would you give them?
Thank you, Paula, for that question. And I want to thank all the panelists for all your sharing. It's very inspiring to me. And they certainly resonate a lot of what I've heard from the focus groups and workshops. In terms of raising awareness, I think there is a lot there that people can do. Have a look at the strategy and the worksheet itself. There's several ideas for awareness, and then you can also, in that spirit of motivational interviewing, I would also ask each of the clinical team or individuals to think about what you could do, like what's the next right step to do. And there are two tools, like in the province, like what matters to you. It's just one simple question that perhaps you could ask at the beginning of the clinic visit. And it could come in a variety of forms. It could be like, what is important for you today? Or what are you hoping to accomplish with our time together today? And start with that and anchor your visit perhaps accordingly. And I think this is like those small steps that you don't need like a project approval or anything elaborate to do. You can just start with yourself. And if you're maybe not comfortable in doing that, asking a patient about that yet, ask your colleagues. So I think it's about just modeling what we're talking about here among ourselves, with the people we work with, and even with other people in our lives. I hope that answered the question, Paula.
Thank you. No, thank you for that. Deb, we had a little bit of a conversation earlier on, and talking a little bit about goals of care. So, how do you bring that into the work that you do?
Oh, thanks, Paula. It's been really interesting. Just while we've been meeting to get ready for this presentation, we've been talking about small achievable goals so people feel success in the day-to-day, sometimes difficulties, like a success would be feeling a little bit better after a run or something like that. One of the very important and very challenging discussions we have over time is goals of care. So there's goal setting for the smaller achievables, and there's the goals of care discussions. Many of our patients in acute outpatient settings have multiple comorbidities. They have more illness in addition to end-stage renal disease concurrently. And so we have very difficult but important and meaningful conversations with both the patients and families. Kathy, as a family patient partner, I believe you would have had many of these conversations with your daughter. And Laura, you're having goals of care, longer conversations about the future and how you want your life to look like, particularly for our more elderly. What do you want life to look like? What's it like being on dialysis for a long time? What would you want to see happen if you became, or when you became more frail? And so those are very personal and difficult conversations. Helen talks about what matters most, and we have serious illness conversations and goals of care conversations and what matters most. And they all have slightly different meanings, but the bottom line is we want to know what's important to our patients as they age and as they move on in the dialysis process. And so in an outpatient but acute care setting, these are very, very important pieces of our work. And we want to make sure that your values, spiritual and faith-based beliefs are honored. So this could be another session in itself for next year.
Exactly.
But that's a huge piece of the work we do here in an acute setting.
Thank you, Deb. And we do have a couple of questions here. So I'm going to so I think, Deb, you kind of maybe answered this. How do you initiate goal setting for patients who are just starting their CKD journey and may not understand the importance of it?
I should say I don't work in the kidney clinic, but it's the same as starting a relationship with anybody in any setting. And I think it's really important to find out what someone knows and what their fears are. We heard at the beginning, Laura and Kathy, about the overwhelmed fears. It's also adult learning. How much can we digest and how do we like to receive information? So I think one of the beginning things, Laura, I see you nodding, and I hope this happens for you and Kathy, for you and your daughter. How do you like to receive information? And what's the best way that makes you feel heard? I'm on screen, but I'm pointing at Laura. How do you feel heard? What do you want to learn? And so that's the beginning of any interactive relationship, I would say. What do you want to know? What do you know? What are you afraid of? What are you hoping for? What can you tolerate? Things like that. And what do I need to know about you so that you know that I want to work with you and I'm happy to work with you and I honor you.
Absolutely. And I would say to that, oh, sorry, Laura, because I think this question leans into that. To what Deb has just said about what do you need to know? What does she need to know about you? This is an interesting one. So I put this out here for you, Kathy and Laura. I've been called the question or the comment. I've been calling patients at home on non-hemodialysis days versus seeing them in the unit. At first, I was thinking I'm bothering them on non-hemodialysis days, but it seems to be better detailed private conversation. So what are your thoughts on that? If your caregivers are called, do you feel like you're being bothered? What is it that you would want? We can start. We've got about a minute here. So Laura, do you want to do your 30-second?
Yes. I just also want to say something that is important is to understand that your patient might not realize what a certain term means. So it's very important to clarify what we mean by this or that. And as for being called at home, I think that it would be a nice thing because it is hard to maybe share something or have a discussion that's a little more serious when you're in the unit because those thin curtains really are not attentive silence. Everybody can hear you. So I think calling it home would be great.
Thank you. Well, you know what? We could go on forever. We'll try to get to your other questions by another means. But we're going to have to, unfortunately, end it here. I just want to say I am so inspired and humbled, and I have been in this business for a long time. So thank you for the incredible conversation for everyone watching. But now we are going to have a 5-minute transition break before the Wilma Crockett Awards start. And so that's 2 p.m. sharp, I was told. So stay tuned and thank you all. Appreciate it.